past 11. Can I have a motion to open the meeting for August 19th, the Board of Health?
Yeah, I'm not sure. I moved to open the Board of Health meeting for August 19th.
Second that, Susan Elwell.
All those in favor?
Aye.
Aye.
And present is Frank.
Yeah.
All right, well, following the agenda, we have general business. Frank, you want to start discussing the
Sure.
potential fall perk season?
Yeah, as you know, every year we look at things, how the season's going with perk testing for new construction. Every year the board usually sets some parameter for timelines for new construction. We haven't done that yet, so if you'd like to set a time frame before it gets too cold in the winter, we can do that. Normally in the past we've only done late August, September, October, mid-October, but again, you can set any time you like.
Well, of course, one issue now, though, is that we're down an important employee.
Right.
So we really have limited field capability.
We do.
Would that be a factor to,
We have one or two applications, so, repairs, as you know, go on continuously, but for new construction, we have one or two, which I believe we could manage, if we need to.
what would you recommend for a fall perk season?
Well, we could start as early as next week, or we give them September until maybe mid-October, is what we usually
Yeah.
do.
I think
We've
that
had
sounds
plenty of
fine.
rain, so it's
Yep.
all
Yeah.
dried up.
Yeah. Would you like to do maybe the 23rd of August, which is next Monday, through October 14th, 15th, something like that?
Yeah, sure. Is that your recommendation?
Yeah, that should be plenty of time to.
Okay, so why don't we have a motion to establish
Yeah, what do we say, the 14th?
14th of October?
Yeah.
And I'm not sure. I moved to extend the fall perk season through the 14th of October, starting the 23rd of August.
I'll second that.
All those in favor?
Aye.
Aye.
Okay. And just for the board's information, we have a posting up for our health agent position. It's been up this week, it'll be up next week, and then that opening will close, and we'll be interviewing candidates. All right, next, review guidance on masks concerning COVID-19. Frank, what do you have to contribute to that?
Well, right now, our recommendation is a strong recommendation to wear masks in indoor settings, and we're watching.
And we
the
put
data.
signs,
We did.
put signs up in most business establishments.
Yep, we did.
Susan put up a lot.
I'll do a bunch this afternoon.
Oh, good, good. And you know, and you, oh, good, you've got a listing of,
We've got the list. I
Yep.
checked off what I had done.
okay. If I can interrupt,
Sure.
a news flash is that I was told late yesterday that Market Basket is going to require masks for all their employees. And I stopped by this morning, a little after 7, and they were all masked up. So that's an improvement. And anyway, why don't you continue with what?
Yeah. So we were actually just on a call yesterday with the surrounding towns in our coalition, and, we were talking about the whole mask subject in general. One concerning the schools, and one concerning just the general public population. And right now, all the towns in our immediate area are pretty much right where we are at this point of, again, strongly recommending masks in indoor settings. And again, everyone's watching the data to see where things go, but that seems to be the consensus in the area. I know some large cities did already start, mandating.
I think Salem has, right?
Yes, and I know that was a lot to do with their big season coming up, but, it's also a much larger city. So yeah, that's where we're at the moment. The town buildings, Mr. Chairman, you met with the selectmen to talk about the public buildings, and I get strongly recommended to do it now. So that's where we are right now.
Okay. Anybody from the board have anything to?
Well, it was interesting when I went passing out flyers, because first I started by saying to them, it looks like you've done a great job here. They had places to stand, things up, and I think all the businesses have done their best. So I started out by complimenting them, and they've done a good job. But Market Basket took our flyer and they reworked it, and they put their name on it instead of Raleigh Board of Health. And then they came up with a new thing, I suspect, but and people that have businesses know enough, I think, most of them, to do what's approved. And you have to really think about those things. So everyone was nice.
Well, and in my distribution effort late last week, I was very pleased. Many businesses actually put them up while I was there. However, some ducked behind excuses. They had to talk to the manager, or
Well, it's
and then
nice.
and then on checking it over the weekend or earlier this week, a number of businesses conspicuously haven't. And I've been going back to some of these, and Frank is too. We're strongly recommending it,
Yeah.
which is
That's the
almost like the next step to requiring. It's important, even though our numbers, and Frank will talk about that in our next item, but our COVID numbers have not jumped, but we're still on top of trying to get people to do the right thing.
I think everyone's tired of it, basically, so you have to kind of work your way and be nice about it.
Well, there's no excuse to not be prudent in public places. Is there anyone in the audience that has something to offer on this subject?
Yes, I do. This is why I'm here, so thank you.
Would you like to sit at the table so we can hear you through your mask?
Should I close this?
I would. It's not that hot here today.
Well, we put it inside.
We'll leave the fan on.
Well, we don't want the noise. Is this microphone the microphone that's working? Okay.
Oh, good.
Yeah, I have a low Midwestern twang, but I've lived here for more years than I want to say. So I lived in Raleigh for 30 years, but so hopefully.
And your name?
My name is Terry Davidson. I live on Glen Street.
You have a little sign issue, if you don't mind.
Yeah.
Thank you.
And I'm representing, maybe 10 or 12 people that I've spoken to, and I know there are more people who, are concerned about the virus spreading, not having an indoor mask mandate, and wanting to be proactive. So I'm representing myself, but also representing them, and and I want to support what you guys are doing in the Board of Health. I think you have an incredibly difficult job to do. I think that right now the voices of people who are not in favor of masking indoors and or vaccines are louder. But, I think that the majority of people do want to not get sick and to not see the situation get worse in the community. So So I guess my question to you, because we know masking, indoor masking is so effective, I'm thrilled that Market Basket employees are gonna be wearing masks. You know, I know people are wearing masks indoors, I see them, but I think the people who need to wear masks, who engage in risky behavior with COVID, who may not be vaccinated and generally are not wearing masks indoors, I mean, those are the people with, you know, more potential to spread the virus. So I think anyone can now if you get a breakthrough case, you know, with COVID. So I guess what are the metrics that you would need to see? Because Rowley is not an island. We are, you know, we have a regional shopping center. You know, people come from all over. I'm sure that I don't think there's a requirement for town employees to live in Rowley. I think people come from everywhere to shop here. So, you know, I know the numbers are low today in Rowley, but what would be the metrics that you would use?
To
Well-
make a mandate,
Yeah, to make indoor
to
mask.
issue a mandate.
Yeah.
Well, I kind of think of the situation, the surveillance aspect of what we're doing with COVID, with the cooperation of our public health nurse who's tracking our state database on a daily basis and keeping track of the contact tracing information. I kind of think of it as the same process as we do every year with mosquitoes and equine encephalitis and our traps that we have in town that we check each week with mosquito control, and checking with neighboring towns and their traps to see how the numbers go. And we're on top of that as we have been for the 20 years I've been on the Board of Health. And that's what we're doing as far as COVID is concerned. Frank's in a regional group of health directors. They talk weekly, if not twice a week. He's on a panel with the Triton Regional School District, with professional health people. They bring their stories in as far as the 3 towns in Triton. So we're on top of it, like we are in the summertime with mosquitoes and mosquito control. Right now it's low. We took the initiative to raise awareness by going to the selectmen's meeting earlier this week, and what was it, last week? Last week, and then developed a campaign for our signs, and got them out. It generated discussion, and as far as I'm concerned, and then the rest of the board can voice their opinions, we're watching it very carefully. And if we see a reason in the numbers to get very aggressive, we would plan to do that. To do that, for us to issue a regulation is not as easy as just a vote of the Board of Health. We have to have a public meeting, announce it, it has to be posted, people have to have an opportunity to comment, and it has to be posted in the newspaper. It's a time-consuming thing. We're hoping that the numbers don't go up. You know, that Massachusetts will be a state that's protected itself. If they do, we're going to be watching, and we're going to be expecting the State Department of Public Health, who has an easier time of mandating masks, to be assisting us. Right now, they're just nowhere to be seen as far as mask requirements. They're holding off on that. And they're leaving it up to towns like, cities like Salem, that has a large population, more numbers of incidents of COVID, and the next 2 months are gonna be crazy with, you talk about people coming to the Market Basket and shopping center. Everybody in the world is coming to Salem, and they're wearing costumes that don't go well with masks. So I can see why they alarmed it first. The other towns are highly populated and densely populated. So we're watching it, Frank's watching it, and we appreciate your certain interest and your group's interest, but we're not turning our heads. We're on top of the numbers, and we investigate the cases when they come up.
One thing if I could add, Mr. Chairman, too, is the other thing we track is how many in a household, one family. Say there may be 6 cases, 4 maybe from one household,
Right,
or
right.
3. So we take that into account as well.
Right.
And as well as what's going on in the surrounding towns, like you mentioned, but I just wanted to add that.
Yep.
Yeah, and I know your focus is on Rowley and people in Rowley getting sick, in terms of, will there be increased numbers? I mean, I have a master's of public health, I went to BU, School of Public Health, I've worked in healthcare for more on the communication side than the statistical, epidemiological side of things. But, I know, because we're not an island, we don't have borders, we can't control people coming into Massachusetts, though we're lucky in New England that, all the states are fairly low transmission rates at this point. I don't see us, at some point, there's a surge, there's the apex, and then it goes down. The apex occurs because there's changes in behavior. Either everyone around us is vaccinated, that's gonna help, or there are other tools in our toolbox, masking, indoor masking, because we know indoors is where, the transmission mainly occurs, crowded indoor spaces without ventilation, good ventilation. So, I think, if the national picture changes, we may have, again, the trajectory of going down. I think all of us want the trajectory to go down, but we know that there's a certain arc to this, and we've gone through this for a couple of times. So I would just, be mindful of, I'm just saying, and you guys are the officials, so I would just be, mindful of that. I think with school starting, I think that, I don't have school-age children anymore, so, I find that to be, a potential tinderbox. I just read an article out in Israel, which is highly vaccinated. They stopped indoor masking in June. Family went on vacation. This is how, in a small area, things can, explode. Family went on vacation. One of the children, the only person in the household, non-vaccinated, picked up COVID. The parents did not quarantine it for the 10 days that they were supposed to. We don't even have that in this country, quarantine. They didn't do a PCR test. He went to school. Everyone's guard was let down with no masking. 8 kids got vaccinated. Second school, the same thing happened. And then it was transmission throughout the country. They had 0 deaths in June, 265 deaths since then, or in July or August. So, you can spiral out of control with the school. opening in a few weeks. So even though everyone's intention, that we don't have testing, that's widespread. So I'm just giving you my perspective. I really respect what you guys do. You don't have an easy job. It's politicized. But happy to hear about Market Basket. I mean, that's the one place that everyone goes to. You know, I don't know if one place could have a mask mandate in yours, but that is, you know, where elderly have to go. You know, that CVS and Market Basket, you know, I know there are restaurants, and I know there are other small businesses, but, you know, that could be, again, where people have to go. I don't know, is it mandated in the town, wearing a mask indoors? In the town offices?
Yes,
Wear a
yeah,
mask?
that was done last week, and signs were put up, and it's being followed.
That's awesome.
Well,
That's awesome.
Yeah,
Do employees need to be vaccinated?
that hasn't been mandated yet.
Yeah.
That involves the selectman's office and the personnel and labor rules, union rules. It's
Right, yeah,
an
sure.
administrative nightmare to administer that, to make that work. So, no. But we will be using this new news alert that Market Basket has come into our way of thinking today with other places that are sensitive to a lot of public traffic. And it will be helpful to some extent, shame them into wanting to get into the mask behavior.
Right, I mean, they could require their customers to do that.
Of course, yeah. So we're on that.
If I could add something, Mr. Chairman, months ago, we worked with the Council on Aging to help people that weren't comfortable going to Market Basket, the seniors. They would do their shopping for them, deliver it. So we could revitalize that. I can talk to the COA about that.
Yep.
For people that really are concerned or afraid or.
Right.
And I've already been in contact with the local pharmacy to make sure we're high on the list, and I've been told we are on the top of the list to have vaccination clinics for the booster shots when they're available, when the CDC has even established the regulations. So we're on top of that one. We want to do it in town as best we can, as we did for the elderly earlier in the year. We would have done more if there had been vaccines, but the vaccines were rationed locally and went to more regional things. But most likely with the booster program, it's going to be locally implemented.
And all those big places are not,
They weren't as successful as,
yeah, they're shut down.
They are.
So,
right?
You know, it will be.
I heard yesterday that the booster is going to be suggested for 8 months after your second shot, so something like December or something, so.
Well, no, I got mine in February.
Yeah, we did our
Yeah.
elderly in February,
This
it's
is
February 4th and February 26th.
Yeah, we're coming up.
Yeah.
It's at the end.
Yeah, oh no.
Yeah, so that's October.
Yeah, it's October, right?
Yeah, we're looking
Yeah.
for October to get started.
Also, Mr. Chairman, from what I understand, I don't know if this is old data, but they weren't planning on reopening these mass vaccination sites. They were going to lean more towards the doctors and pharmacies, but that could change. But that's the latest I've heard.
Yeah,
That could change.
Pharmacies are so convenient, it's wonderful.
Yeah.
You can just walk in.
And especially with the boosters, encouraging people to talk to their doctors first. So I think, but we'll see.
Yeah.
See what happens.
But those are already available if you're immunocompromised.
Yes.
Right.
yeah. It's a matter, yes, they are. Well, thank you for coming.
Well, thank you. know it's an open meeting. Thank you for letting me expound on my thoughts. So, as I've said, I do marketing, communications, awareness about healthcare. Happy to help publicize, for the boosters, I'm sure. I mean, you have a willing audience among the seniors, so, but, that's what it's about, trying to get people who are hesitant, to get vaccinated, that's the key. Thank you.
Thank you.
Thank you.
For coming.
Let's see, so, continuing on that same thought, I just wanted to mention a little something about the Triton Regional School vaccination effort that is ongoing this week. 3 different sites, one in each town, Salisbury, Newbury, Rowley. It seems like this was a quickly put together effort. I found out about it Saturday morning. There was no interaction with the Board of Health offices. Connolly's Drugstore was involved, and they're doing it. Tomorrow there'll be the Rowley Clinic for school-age kids and people over 12 years old, so school-age to 12 plus. I personally was disappointed that the school district failed to team up with the health departments. Everyone knows vaccinations fall under the purview of health departments, and schools are in the educational business. I voiced those concerns with the superintendent of schools yesterday, and he and I are going to have more discussion on that, and he's in full agreement that in the future we'll team up and work together. And one example of why that's in the best interest, had we known that this was being planned, and I want to find out how and who was involved in this planning, we could have worked with the provider, Connolly's Drugstore, and gotten much more publicity so that immunocompromised people could have gone to clinics this week. People that need shots could have gone, say, to the Rowley School Friday and gotten their first shot. So it was just an opportunity in a public building with loads of parking missed. And so next time, we're hoping we can be a part of that, if there is a next time. I know it was a rush job to get things done before school starts. But in the health business, rush jobs aren't always the best jobs. So anyway, I just wanted to just mention that. We're certainly supportive of what they're doing. I think there's one in Salisbury today, at a school in Salisbury, and there'll be the one in Rowley tomorrow at 10 o'clock at the Pine Grove School. So what is next on our agenda here? Do you have some bills for us too, or do you have something?
Just a little update. We were at 6 active cases, but there was some activity this morning, so we're working on that as we speak. But overall in Raleigh, which isn't too bad. It's in line with what's going on in all the towns.
Is anybody hospitalized, or is it?
Not that I'm aware of, but we're still working on a few of those. So anyway, like I said, it was a little activity this morning that we're working on. A positive note, the vaccination rates in Raleigh are going up a little bit. Back in June, we were at, overall, for all the age groups, we were at 61%. And then July, we jumped up to 63, 64%. We do it every other week. And then these first couple weeks of August, we're up to 65%. So it doesn't seem like a big jump, but it is.
It's going the right way.
Going the right way, exactly. And again, the other towns are seeing very similar trends.
And people could go to CVS
Right,
or Conley Drug
exactly. Is it-
easily. I mean, there's no long lines.
Right, as a matter of fact, on our website, there's a list of local
Yeah,
pharmacies
see,
that
that's
are
great.
offering it. There's also a link for veterans too, if they're having difficulty, that they can get some assistance. So, yeah, and again, of course, the doctor offices are doing their part.
All right.
And just one last thing, next week, Wednesday, August 25th, our data review committee that we work with Triton Regional Schools will be meeting during the day to talk about the mass discussion in schools. And they'll gather the information from all the different people in the group and bring a recommendation to the school committee who will be meeting that night.
For the mask
For the mask.
policy for the schools?
Yes. So, again, they'll be discussing that. But again, all the towns put their input in.
And your data review group that you're a part of and has been meeting for months,
Oh,
right?
yeah,
Since maybe the
yeah,
beginning.
Exactly.
You were no part of this vaccination effort. I mean, that wasn't part of what you were involved in.
This one going on right
Yeah.
now? No.
No. Okay.
I mean, we support it, of course, but.
Oh, yeah, but you were involved.
No.
Okay.
Um,
Shall we jump to office administration?
yeah, sure. Don't have anything to sign right now. We took care of that this week, but.
No bills.
No.
Beautiful, no light bill. The freezer.
There's some
Minutes?
Minutes in your packet.
Yeah.
From our last meeting.
Excuse me. All right.
It was nice to see the road thing in the light bill
Yes.
from us. Good.
I want to say these minutes are very well put together.
Aren't they nice? Oh, they're wonderful, Joe. Thank you. Thank you, thank you. Very readable,
It's almost like a short story.
beautiful.
And it's fortunate the mosquito issue has been dormant, and the tick situation has been
Yep.
quieter than other
I
years.
think that's thanks to the herds of turkeys we have here.
Glad you mentioned that. Yeah, we're watching that every week also.
Yeah,
So far, the goodness, we're in good shape now, and the surrounding towns as well. So, again, we need to watch that.
all right, well, could I have a motion to accept the minutes of June 22nd?
And I will make that, I guess I'm the only one that can. I move to accept the minutes of the Board of Health meeting, June 22nd, 2021.
I second that. All those in favor?
Aye.
You want to sign yours? And then we should set a date for our next meeting. Let's see, in September. Maybe towards the end of September?
Yeah, we can see what comes in the
I
office.
kind of like to get a date set.
Yeah, we should. I think
This
that's
is an important time, Frank, and
Yeah.
I don't want to slide things. Who knows what's going to be, we can always not have the meeting
Right.
when we get close, but
Okay.
there
Yeah,
could be.
Sometimes things come in that the board needs to vote on, and we just don't know when that happens. But yeah, we can certainly change.
Well, we know there's going to be a request for action on that septic system
Yeah.
situation off Dodge Road, but,
As a matter of fact, we're having a department meeting about that next Monday. Talk about some of those,
Uh-huh.
not just our issues, but the other department's issues.
good,
We'll keep you posted on that.
good. So what about a date? I don't have the calendar in front of me. You got any golf tournaments in September?
Yes,
So, well, we don't meet on the weekends anyway.
that's correct.
No,
Uh,
a Wednesday or Thursday during the day for me is good.
That's fine.
Okay, should we say the Thursday, the 23rd?
Okay.
Is 11 good for,
Yep, good for me.
so let's say that.
Yeah, we'll see again how things go, and if we need to meet sooner, we will,
Right.
Okay.
Well,
Can I ask a question on the notes about the landscaper? The man came to us and said he was concerned how it would affect the neighborhood on Maple Street. Did they resolve that?
As a matter of fact, sorry to interrupt,
No,
but,
that's
matter of fact, they met with the ZBA last night, I don't know what happened.
Oh, okay. So
But they
it's
were,
just-
it was continued to the ZBA meeting last night. I couldn't find out
That's okay, I just
what
wondered.
happened, but I'm not sure if it was
There's not much
concluded.
we could do about it.
No, Mr. Neville came in, as you remember, and
Yeah.
voiced his concerns, which were our same concerns, and, but I just don't know the outcome. I can
That's fine.
okay, well, can I have a motion
On
to
those-
close the meeting?
John Melcher, I move to close today's meeting.
I'll second that.
All those in favor?
Aye.
Aye,
Good. Thank you.
excellent.